Hello, everyone, and welcome to a Turning Point panel discussion. My name is Kiara Cotton, and I am here with some amazing ladies today, and we're here to discuss the emergence of Black-led groups and how they're addressing the shortcomings of traditional healthcare, specifically as it pertains to Black women here in Northeast Ohio. And just to give all of you who have joined us for this panel tonight an idea of why we're having this conversation and why it's important, I'd like to begin today's discussion with a quote and a statistic. So according to the Association of American Medical Colleges, just 5% of active physicians identify as Black or African American in 2018, and that is compared to more than 55% of active physicians who identified as white. And that study was done in 2018. So I'm joined here today, as I mentioned, by some amazing ladies who are going to help me, provide information just on some resources, and they're doing amazing things in the community that can help specifically Black women here in Northeast Ohio. So without further ado, I'd like to introduce you guys to our panel who have graciously joined us this evening. Up first, we have Jasmine Long, who is the CEO of Birthing Beautiful Communities. We have Dana Lane, excuse me. How do you pronounce your last name for me, Dana?
Langford.
Dana Langford, who is a midwife and founder of Village of Healing. And then we also have Sheree Campbell, who is a new postpartum mother who has benefited from the support of Birthing Beautiful Communities. And all of these ladies are going to be sharing with us their personal journeys with healthcare, and then also telling us about their respective businesses and, how to better navigate traditional healthcare systems as Black women. So Jasmine and Dana, I'll start with you ladies first. If you could first just quickly give us an overview of your respective businesses, and I'll let you guys decide who wants to go first.
All right, thank you, Dana. My name is Jasmine Long, as Kiara stated, and Birthing Beautiful Communities is a collaborative of doulas or labor and delivery support coaches who really try to go above and beyond to meet the needs of Black moms across Northeast Ohio. We're here in Summit and Cuyahoga County, and we do attend labor and delivery of our clients in addition to providing full wraparound services of up to 80 weeks to ensure that babies are making it to their first year of life.
Village of Healing is a community development organization focused on looking at a new dynamic to wellness and healing. And what that looks like is taking our power back as Black women and focusing on our own healing and our own wellness. And we do that through community programming, and just recently our newest venture, which opened, which is a health center that is focused on Black providers taking care of Black patients. And we started with women's health. Eventually we'll grow into a network of clinics to include primary care, pediatrics, dentistry, and mental health.
Amazing. Thank you guys again for your willingness to participate. Dana, you mentioned it briefly. Congratulations on your new center. That is awesome to see that being open. But you talk about that Black care to take care of our Black patients. Why is that important? And why did you see a need to open this center to fulfill that need?
Well, just from personal experience and the lived experience of being a Black woman in the healthcare system, number one, as a patient, and number two, working for predominantly white institutions and healthcare centers as a certified nurse midwife, we see the racism that exists within the system on both spectrums. As a patient, as a family member of patients, and then as an employee and as a provider. Outside of that, the statistics all support it. The statistics say that when you have a Black provider caring for a Black patient, the racial disparities decrease, the outcomes are improved, and the satisfaction is increased. The latest study that was made public and known was that when a Black infant has a Black OBGYN taking care of them, their infant mortality rate drops by 1/3. And that's just simply because I walk in the room to see a Black patient that we see that. And so it's the importance of a culturally sensitive ear, the importance of somebody walking in with the same lived experience, whether no matter their profession, no matter their income or anything like that, it's just walking in to be seen and heard that's happening, and that's creating this huge decrease that we see in disparities in the improvement in outcomes.
Jasmine, I saw you nodding along. Did you have anything that you wanted to add to that as well?
Yeah, I think that's what, and Dana and I work very closely together. So I'm nodding along because I think it's, the literature shows it, right? Funders want to hear evidence-based. Everyone wants to know what the data shows, but we didn't need data to show us the importance of having culturally relevant care. And so the reason that even doula services, it's not just doula services that are impactful, it's community-based doula services. So you're hiring women who are from the neighborhoods, who are most impacted by infant mortality, who look like the clients that they serve, who have some semblance of a lived experience, who can step in and be that either sister figure, that mother figure, that grandmother figure. Because, our organization, we have a multi-generational staff because different moms are looking for different things in their birth experience, and different women need different things to help support them through their birth. And so just having somebody who has some semblance of a lived experience with you makes all of the difference. And we know that. And we didn't need research to tell us that either.
Amazing. And Sheree, you have benefited from the work of Birthing Beautiful Communities. Can you speak to your experience taking in those resources and how it impacted your pregnancy journey or postpartum journey?
Yes, so I actually got a doula late in my pregnancy because one of my best friends had a baby earlier in COVID. And she was like, you have to have a doula. Like, it's the best thing for you as a Black woman going to a white institution to have your baby. And then also it's COVID and your mom can't be there. Like, wow, your boyfriend's got to be great because it's his kid, but not having your mom, you'll really want a doula. So I got a doula maybe, I had my daughter in May. I got my doula maybe in February. And then just having that doula in the room just really helped to calm me down and help me with like the emotional support. And she was able to speak for me when I couldn't speak because I have high blood pressure. So at one point my blood pressure was high, the baby's heart rate was down, they had to make a decision. And I was just like kind of out of it. And she was there to help me realize, like explain what they were saying and what were the next steps right before I ended up having a C-section. So it was just great to have that female presence and that doula who was just trained to be there and support me in the room.
Now, is it okay if I ask, was that your first pregnancy or had you had pregnancies prior to this one that were different with that doula experience?
No, I had a miscarriage 4 years ago, but this was the first one that actually went through.
Okay. Well, congratulations on the birth of your new baby.
Thank
That's
you.
amazing. And I'm glad that you were able to get those resources. Dana and Jasmine, can you talk to people about how they can find these resources? Obviously, Sheree has benefited from them, but if someone is thinking of having a baby or, struggling with that process, where can they turn to get those resources?
So I'm going to plug both of our orgs right now because I have really been excited to send people Dana's way for the care that they are providing. And that extends beyond just pregnant or newly postpartum women. They are really supporting well women's care even before, I'm not a mother, never been pregnant, but when I received gynecological care, I've always gone to a certified nurse midwife for services just to show that you do not have to always go to an OBGYN to receive those kind of services. So look, that's me plugging Dana. And then we refer to Dana's organization. And then a lot of our work is word of mouth, but we want people to know about doulas. And, Sheree was saying how she got a doula late in her pregnancy, but for many individuals coming from our program, a traditional doula is only going to meet you maybe a month before your pregnancy. So our organization is unique in that we will take women from the time that they're 12 weeks pregnant until their baby is a year old and really provide that wraparound hands-on support. We have a website, birthingbeautiful.org. We're on every social media channel as Birthing Beautiful. And we're always really ready and willing to take clients. And we take clients from both Summit and Cuyahoga County. Those are our footprints, and we are really happy to take women along their journey.
I think too, it's why it's super important for Black women to walk into these systems with doula, and especially, and let me be very clear, a Black doula, is that when you come to the Village of Healing Center, we're here for you for your antepartum care or your prenatal care, right? But at the end, you're going to have to walk into one of these predominantly white institutions to deliver. And what we want our patients to recognize is the benefit of the Village of Healing Center is that you get a Black provider every single time you walk into the clinic. You get a Black experience every single time that you walk into the clinic. However, we do recognize that you're going to go into that hospital to deliver. And the reason that we are okay with that is that, and I'm not being there for the delivery, is that when you walk into any hospital system to deliver, you don't know who's coming in to deliver you. But here's the thing, you said earlier, only 5% of physicians are Black. Let me tell you, there are only 3 to 8% of midwives that are Black, taking care of the most vulnerable populations. So that means that 93% of people that walk in to see to any of these predominantly white institutions to deliver are probably going to see a white provider. And so what happens is this is why it's imperative to have a Black doula at your side, because the statistics all say you would probably walk in to see that white provider, but that Black doula is going to have your lived experience, and they're going to be able to speak up for you. And like she said, even when you're out of it and you feel like you can't go on, there is somebody there that is there for you and for your care. And so we work very closely, like we said, with BBC. We also work with Pregnant with Possibilities as well. And when you enter into any of those 3 doors, you're going to get one of us in that cycle. And what I love about all of our care is that it's a full wellness care. So all of your resources, everything you need, you're going to get from one of us. And if we can't give it to you, we know what resources to send you to.
I think it's a new day and age, Kira, to your point of what this conversation is about, where even with the work that we're doing around our birth center, we know that less than 5% of birth centers in this country are led by not Black people, people of color, right? And so when you distill those numbers out by race, it gets even smaller and smaller. But gone are the days where we need the Superman to come in and save us and our community. We know that by us stepping in and providing those full wraparound support services to every Black woman that we can, we are going to, in evidence, save her life. We save a mother's life, we save that baby's life, just by virtue of us showing up, by us advocating, by us knowing our stuff, by being on our P's and Q's. My doulas are so well trained. We are always doing advanced training because I want them to be as informed as the midwives, as the OBGYNs, as the labor nurses. Anybody that's in that hospital, my staff has to know their stuff so that when those moments come and a client may not understand what's happening, they can explain it clear as day and break it down to any level that needs to be broken down to. It's a sisterhood. And that's the other part of this. It's just, we have really formed a sisterhood with these organizations that are run by these incredible Black women who are my colleagues, who are my friends, who are my sisters, who are coming together to say, we do not want one more baby dying while we are on this earth. And what do we need to do to step up and say that this is unacceptable? And how do we change the narrative around that? And how do we educate our community? And how do we provide the support services to ensure that babies are making it to their first birthday and beyond?
Sheree, I saw you light up when she mentioned that it was a sisterhood. Can you speak to that?
So like my doula that I had, she actually knew my cousin. So then my cousin is also a doula through Birthing Beautiful Communities. So just having just her setting me up with that particular doula or with the organization overall. And then just like, even after my baby was born, she still called and check on me. She'd come over. Like even now, I don't really use her as much as like in the home with us, but she's still checking on me. Like, how's work? How's the baby? Are you planning the first birthday? Like, are you ready? Like, I feel like I have like a new sister in my doula that I gained by having my daughter.
That's absolutely amazing that you got that experience, and it continues to evolve as you and your baby evolve. Dana and Jasmine, I do want to ask you kind of like the nitty gritty questions. I hear you guys talking about all of these resources and things that are available to these women, but what do you say to someone who is like, how would I be able to afford a doula? How would I be able to afford these opportunities? A lot of women, the Black community struggles with poverty, et cetera. What do you say to that woman who's saying like, there's no way that I could afford these services, these amazing services that these women are describing?
So I think that's why Birthing Beautiful Communities exist, to provide doulas. We provide our doulas free of charge. Our services are completely free to women who are seeking them for exactly that reason. One, it's a re-education about what doulas are, what the role of a doula is during your labor and delivery, and how we can provide support services and drive down infant mortality. So our services are free of charge. And I'm gonna let Dana talk about her services because we have a lot of different partnerships as well there.
So we do accept insurances. Right now we're taking CareSource, Medicaid, and Anthem. We're waiting on the other insurances to go through. The only one that we don't see happening right now is United Healthcare because they're not accepting new providers. However, if you are watching and you have United Healthcare and you want this culturally sensitive care, please contact United Healthcare and let them know that you need us to be accepted into United Healthcare. But if you don't have insurance, we do have a self-pay option, and we also have a membership option. So we are not limiting our services to Black women. Everyone deserves good healthcare. Everyone deserves to feel that same sisterhood that Sheree was just talking about. And it's our mission to make sure that happens.
And Dana, we know that when services are impactful and work for Black women, that they will work for the rest of the community, right? So we have a
Absolutely.
firm understanding that if our services are successful for our community, they will be successful for outwardly as well.
Absolutely. Absolutely.
I'll kind of ask each of you, what advice do you have to women or Black people in general when it comes to sticking up for themselves in these traditional healthcare spaces? We all know what it's like to, not feel seen or to not feel heard, but what is your advice to women and Black people in general when it comes to sticking up for themselves?
Well, I'm going to start this one. The first thing is coming to another system. We have systems that are available now, and we have providers that are available now, that you don't need to endure that abuse. And that's essentially what it is. It is abuse. We see it when women go back into the hospitals for deliveries, their PTSD, when they even enter the system to say that they're pregnant. The amount of trauma that I have experienced being a part of PWIs and watching women have to come into those systems, that doesn't have to be anymore. Like Jasmine said, we are in a new day and age, and we are taking back our power. We are making sure that we are not only surviving, but that we are thriving. So that would be number one. But number two, have an advocate for you. You should not have to go in and be at your most vulnerable and fight too. That's just not fair. And that's one of the reasons why we left the system, Tanisha, myself, my partner, to come and start Village of Healing, was because even as family members of patients, we were fighting way too hard. We were fighting way too hard in their systems. So make sure that you have an advocate. And so I know that doulas are just for pregnant women, and Jasmine and I have had this conversation. Everybody needs a doula. Whether you go in for your high blood pressure, whether you go in for your diabetes, everyone should have a doula, but you need an advocate to be there for you, to be able to speak up for you, and to make sure that you're receiving that care.
I remember talking to a provider once, and they said that there will be clients of theirs or patients who will have a burning, pressing question that they will be afraid to ask their entire appointment. But when they get their hand on the doorknob, they'll turn back and ask the most pressing question that they had the entire time. It doesn't matter our socioeconomic status. You could be the most powerful woman in the CEO seat when you are in a boardroom. There is something about going to doctors that is the great equalizer sometimes. And it really does matter that you have an advocate. And for our doulas, they're going to talk with you before you go to your doctor's appointment. So if you have those burning questions, they are going to empower you to ask said questions. And I always say everyone needs a doula for everything, because it is really challenging sometimes for people to ask those burning questions and to advocate for themselves. So you need somebody that's going to hold your back, have your hand held, and ask those questions, because as Dana said, you should not have to fight in your most critical and your most vulnerable time. When you're on that labor and delivery table having your baby, that is not the time for you to be fighting with your doctor, nurse, or anyone else. You need to have somebody there who truly has your back and is going to step in and for you and basically stand in the gap.
And ladies, our time is winding down. I know we have about 12 minutes left here to discuss, but I just want to kind of slowly wrap things up with the question of, I've heard you guys talk so passionately about your efforts in the businesses that you guys have created, but what ultimately do you hope to see, in your own words, do you hope to see happen through your businesses and with women in Northeast Ohio and taking advantage of the services that you guys offer?
I'll be brief so that Sheree can step in and make her point, because I saw she had one, but it's Sheree finding a sisterhood with us. It is the connection of sisterhood and family, and knowing that it really takes a village, right? That's our tagline at Birthing Beautiful. It takes a village. And so we are there as a collective, a group of Black women to support our Black moms, our Black babies right here in Northeast Ohio, and ensure that our communities are not just, doing well, but we are thriving. Like, we are here to create thriving communities, and the partnership that we have with Village of Healing and Pregnant Possibilities, to me, is an opportunity for us to really change the narrative and to start to drive down the infant mortality numbers that have consistently been bad for more than 50 years in Northeast Ohio.
And I'll just say, like, as a patient, you can't be afraid to speak up. Like, it's your body, it's your health. You cannot be afraid to ask a doctor anything. Like, they might have MD behind their name, but they can be wrong. So don't be afraid to ask that question. Don't be afraid to say what you feel. And if you feel like what they're telling you is not right, go ask someone else. Like, it doesn't hurt to get a second opinion or reach out to someone different. And I know a lot of that because I work in healthcare. So that just taught me, like, just don't be afraid to speak up. Don't be afraid to ask a question, and don't be afraid to seek out a second, third, fourth opinion if you need it.
I think for myself, there's a couple different things. Number one, Jasmine hit the head on the nail, change the narrative. Whenever we have these conversations about infant mortality, maternal mortality, people love to victim blame. People love to say poor Black women and social determinants of health, but we already know that has nothing to do with it. We know that economics has nothing to do with it, socioeconomic status. We know that obesity, because we hear that all the time, is a victim blame game. None of that has nothing to do with it. We know that racism is the culprit. And so we are here to change the narrative to say that because I am a Black woman, I run these risks. And this is the true narrative, and racism is the true culprit. The second thing is to build the collective. I think that, from us starting these businesses, that's what the goal is, to build the collective so that we build a system where we can make sure that we're not, like I said, we're not just surviving, but that we are thriving. And then most importantly, we want Black women to feel safe. I think, with us building these businesses is to ensure that Black women enter into pregnancy, enter into women's healthcare, enter into all of these things feeling safe, feeling heard, and feeling listened to. Yesterday, we saw a patient and she immediately walked in and cried and said, "This is the first time I've ever walked in anywhere and know that I was going to be seen and heard." And that's exactly why we built the Village of Healing Center, and we built it to look like it looks purposely, so that when you walk in, there's no doubt that you are entering a Black clinic. And it's why we continue to build the collective and build the sisterhood with Birthing Beautiful Communities and Pregnant with Possibilities.
Absolutely amazing, ladies. I just want to also have you guys reiterate where your centers are located and any future plans that you guys may have. Plug yourselves, get all that out there. I just want people to have all the information possible.
So the Village of Healing Center is located at 22344 Lakeshore Boulevard, Euclid, Ohio. It's in the plaza with Aldi's, Chipotle, Dunkin' Donuts in the corner in between H&R Block and Rent-A-Center. Our phone number is 216-815-HEAL. Very easy. 216-815-HEAL. That's 815-4325. We are on social media, Instagram at Village of Healing, CLE, and then at Facebook, we're Village of Healing on Facebook. Lord, we are Village of Healing on Facebook. But we are accepting new clients. If you have CareSource, Anthem, or Medicaid, make your appointment today. Obstetrics, so we are taking pregnant patients, prenatal care, postpartum, and all GYN patients.
And our physical space is located on 1464 East 105, right in the Glenville neighborhood. But right now we are doing all of our services virtually out of care for the moms that we're going to be seeing. All of our classes are virtually right now. We are Birthing Beautiful on all social media channels, Facebook, Instagram, Twitter, I have to think about it. And our phone number is 216-307-1538. But our website, birthingbeautiful.org, has everything. There's a referral form. There's a way to do a self-intake so that we can get you services. And we welcome all moms across Northeast Ohio to really come and receive the services that they need. If you have a family member, send them our way, a cousin, a sister, somebody that you know who could benefit from the services. We want to be able to provide them with what they need.
I also want my sister to plug her birthing center. Definitely, because that is a huge feat and it is a great thing and a wonderful thing for the city. We also are going to be expanding into pediatrics, dentistry, mental health, and primary care, more than likely pediatrics next before the end of the year. But I think a Black run birthing center is just a phenomenal thing. And it needs to be highlighted and saluted and congratulated across the board.
Yeah, so we're going to have our birth center hopefully opening in fall of 23, located at 1921 East 66th Street, right in the Huff neighborhood, which we're really excited about putting something right in our community, for our community, that's going to really be transformative. And working in partnership and collaboration with Dana and our team, I can see the vision so clear as day about what this is going to be. And in my mind, we are setting a precedence for some national modeling of how to come together and be supportive and really do transformational work that drives down infant mortality in our region.
Absolutely amazing, ladies. I thank you so much for your time. That pretty much wraps up our panel. Is there anything that you guys would like to share that I didn't ask you? Sheree, did you have anything else that you wanted to add?
Just get a doula. Like, it was one of the best decisions that I can say that I made. Like, whether it's COVID or not, you can have your mom there or not, get a doula.
Awesome advice. Ladies, thank you so much for taking the time to talk on our panel today. There is a Turning Point special happening tomorrow at 7 p.m. that they're going to continue to address even more topics of health and wellness within the Black community in honor of Black History Month. So make sure you check that out on all of WKYC's platforms. Jasmine, Dana, Sheree, thank you so much. And you all have a great night.
Thank you, ladies.
Thank you. Have a good night.
Thank you.